All right, welcome in. Hi, I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I am Whitney, the audiology resident here.
So we are going to be covering some insurance questions that we have on our new show, All Things Odd. But before that, we're going to just kind of bring up our YouTube channel real quick and just let you guys know that we have a YouTube channel. We are we put all of our shows here in different categories. If you head to playlists right here, you can look at the different categories and have all of our different shows. If you miss them, there's actually a category called All Things Odd. So you can kind of look at that full playlist and see what you want to watch. Otherwise, if you have questions about music, hearing protection, research, philanthropy, you can kind of see all the different playlists. Some of them are doubled in different areas, but they're all there. That's probably the best way to share it out if you have a link, and subscribe to our channel. So with that, we are going to tackle our topic for today, and it is actually going to be on insurance questions. And so first of all, a disclaimer that we are not insurance experts, but we have definitely had a lot of questions about insurance, and we just wanted to clear some things up, give you the answers that if you were to come into our office or send us a message, this is something that we kind of talk about a lot with our patients, and they come in and have these questions. And so some of these questions we get multiple times a day, a week, and so we just want to make sure that everybody has the right information. So with that, we're going to start off with our first question of, do I need a referral to come see you? So I'm going to have Dr. Galloway talk about this question.
Yes. So if you have Medicare, the answer is yes, because we have to have a referral from your primary care in order to bill out your hearing test. I think we've gotten this question more often at our office because we used to be in a different setting where that wasn't required. The referrals weren't required because we had medical doctors on staff. So it was just a little bit different of a situation. But since we've moved into our own clinic, that is something that comes up a lot. It's like, well, I got that referral last year. But for Medicare, we do have to have one each year in order to do your hearing test. If you have, other private insurance, likely we don't need a referral. You could always call our office and they'll have you check a couple things on the card, just to be sure. But typically Medicare, yes, and other insurances, it just kind of depends.
Yeah. And obviously, like if you're having an ear issue and you go and see your primary care or an ear, nose, and throat, they'll write a referral over to us anyway. But if you are just wondering, like, let's say you're having a conversation with your spouse or your loved one, and they're like, oh, you should probably check your hearing, you will probably need to at least call in. Sometimes you have to go in to see your primary care physician if you haven't seen them for a while. Sometimes if you saw them within, 6 months or a year, you might be able to just call them and say, hey, I was noticing I have some difficulty hearing and wanted to get my hearing test. And they might just be able to send over the referral without you having to go in for an appointment. So we have someone here as well. So it's our friend who actually does social media for us. So if you watch us on social media, whether it's on Instagram, Facebook, Twitter, or X, Samantha Redinger is actually the one who is doing a lot of our creativity. And so she says that insurance and health benefits can be so overly complicated. So happy to see you covering this and diving deeper into this topic. Yeah, thanks, Sam, for tuning in. I think it's a really good topic as well for people because we get these questions all the time. So good to see you here. So we're going to go back to the next question that we get, and we'll see if Whitney, our resident, can answer this one. So the question is, can I get my ears cleaned at your office?
So the answer to this question is yes. Ear cleaning is within our scope of practice, and as it should be, we're all about the ears. We're looking in your ears, testing your ears. The only thing is that audiologists are not reimbursed by insurance for this service. So there is an out-of-pocket cost for having your ears debrided at our office. We have a very cool machine called the Irrigator. And so it's right behind Dr. Phillips. It is pretty slick. You can come in, and some patients say it's like a little ear massage, but basically we're sending in water to clean out the ear. It's really quick and effective, especially, a lot of times, people will have to, if there's too much wax in the ear and we're unable to test because it would affect your hearing. If people don't, if you want to use your insurance to have that built out, you will have to go to a different location. However, if you pay an out-of-pocket cost, we're able to do it right then and there. So for some patients, definitely worth it. So.
Yeah, absolutely. Especially, I think some of the patients that it's been really worth it to have this system at our office are little kids. And I know that Dr. Galloway can share about a kid that she was able to get out wax before taking ear impressions because their ear canals are so small. And so it's really, really helpful to have something where you don't have to necessarily return to your primary care physician or ear, nose, and throat physician to get the ears cleaned. We can do it quickly and then just get everything done that we needed to get done that day.
Well, and a lot of times we see the situation where, let's say we have a mom and a young child, and they come in for the appointment, and the kid's speech is delayed, and they're concerned about hearing loss, and they need to see an ENT, but they need to have a hearing test before they can see the ENT, and then the kid has wax in their ears. So it just saves a lot of back and forth, even when somebody does have insurance, just to say, okay, I'm just going to pay for it today because I want to be able to get this hearing test done, keep my appointment at the ENT. And of course, we're very transparent about that with patients, but especially when it's a parent and a child. And, there's just a lot of coordination between daycare and everything to get the kid in. So if we can do it all in one swoop, that's a lot easier.
Yeah. Yep. All right. The next question we get is, are you contracted with my insurance? And so a lot of the times, when you call in or we receive a referral from a physician and we call you to schedule, that's one of the first things we do is get your demographic information, but then also your insurance. And there are definitely some insurances that we are not contracted with, but we want to make it clear. So for example, we are not contracted with Cigna or Aetna right now. And when we were setting up our office and we were going through the credentialing process, they just don't have any room for providers to be added to their list. So Cigna and Aetna were not contracted, but that doesn't mean that you cannot come here for services. So you need to check your insurance, because even though we are not contracted, if you check your insurance and you have non-contracted rates, that means that we will be reimbursed on a non-contracted rate. So it doesn't necessarily mean that, oh, you don't take Cigna or Aetna, I can't come see you. We can, as long as you have non-contracted rate benefits. And so we accept that. And so it doesn't necessarily mean I'm going to just hammer it home just because we are not contracted with a couple of different insurances at this moment. It doesn't mean that you cannot come with us. It just means that we will have to accept the non-contracted rates, if that makes sense. Mm-hmm. So again, that's something that I think a lot of people automatically, when they look into their insurance or they pull it up online and they're like, oh, you're not on my list. It doesn't necessarily mean that you can't come and see us. You just know that we will get reimbursed differently than if we were in contract with your insurance. Does that make sense? So hopefully, I don't know if Dr.
Yeah, I was gonna add, sometimes on your card it will say in network versus out of network. So out of network would be us if you have, Aetna or Cigna and you have these out of network benefits. I know for myself, when I've looked up on the insurance website, there's kind of two different columns. Like my benefit is one thing if I'm in network, but it's a different thing if I'm out of network. And so that kind of helps to clear it up, although I know that it is confusing. Sometimes on the card, it will say like out of network and then have a different benefit.
Mm-hmm. Yep. All right. The next question that we have for Dr. Galloway will be, do I have benefits for hearing aids?
So the answer to this is all over the board. So there's a lot of insurances that we know off the top of our heads. Traditional Medicare does not cover hearing aids for anyone. They will pay for your hearing test, but they will not pay for hearing aids. However, some patients have more than one policy. So sometimes we have to check more than one policy. Also, like Medicaid in Colorado does pay for hearing aids, but only for children. So it's up to age 21. So there are some different stipulations. If you have a commercial insurance policy, like let's say you have Blue Cross Blue Shield, when you call them and ask about your hearing aid benefits, they usually kind of rattle off this long thing like, 80% of allowed amount after you've met your deductible, something like that. So what we do in our office is we say, oh, we can have somebody call and check that for you. So that way we can come back and say, well, the Medicare doesn't, but maybe the secondary policy you do have will cover, or we can get more information on what the benefit is. That being said, even sometimes when we get the benefit information, it's not super clear what's going to be paid. And so sometimes they tell us one thing and they pay a different amount, or, sometimes there's an allowed amount that's not disclosed to the patient. And so there's a surprise at the end whenever it's 80% of the allowed amount and not 80% of what was billed. So a lot of patients do have hearing aid benefits, but it's not as cut and dry as you might think. And so that's something that you can ask, your provider about. You can, call your insurance and just say, here's my plan number. What are my hearing aid benefits? The other thing is to ask, can I go anywhere to get these hearing aid benefits? Because sometimes you have a set benefit, but you have to go to a certain provider, like True Hearing or Amplifon or some company that your insurance company is using to do all of their hearing aid benefits and services. So there's sometimes questions to ask that aren't obvious, like what is the allowed amount and can I get these services anywhere? Would be the two that I would recommend asking.
Yeah, and I wanted to add to that too, that with what Dr. Galloway said too, like we have our people check into what we call a benefit estimate, and that's just an estimate. And so I want to point out that we've run into a couple of different things. We had somebody who credentialed us and set up all of our contracts and told us one thing. And so we kind of follow along with what this person had said that we need to abide by. And for us as a private practice and as providers, we are going to be reviewing our contracts on a regular basis because sometimes they change and we don't even know either. And so I know that a lot of audiology boards, if you talk to other audiology or other audiologists and other practices, like they review their contracts because sometimes we're under the belief that it's something, but a year later or 2 years later, it changes. And so again, this is an estimate. Have grace for us trying to understand every single policy that's out there. The benefit estimate that we do from our office is the best estimate. And like Dr. Galloway pointed out, sometimes they'll say something and pay something else. And so we've got to kind of go back and check everything off and see what we can do to make sure that we're abiding by all the different rules in the contract. So just wanted to point that out too, that sometimes things can change and we're not necessarily notified. Most of the times we are, but sometimes if we're just looking at a different contract, sometimes little things have changed that we didn't notice. And so we want to make sure that whenever we run a benefit estimate for you, it is definitely trying to make sure that we are seeing your particular insurance contract as well as nothing has changed on that side as well. So that is for benefits for hearing aids. It's tricky and it changes. And what Dr. Galloway said, it's all over the board. There's nothing cut and dry. So we have to check every single one before we actually give you what we think is best as far as what your insurance is going to cover. So it's a little bit tricky on that question. All right.
With some of the Medicare plans too, specifically, it gets tricky because if it's a supplement to Medicare, they follow Medicare guidelines. So that means they're not going to pay for hearing aids. But if it's a secondary policy, like let's say you are retired, but your spouse is still working. So your spouse has this commercial policy. Then you have two policies and we can choose to use the non-Medicare policy. So it just gets very confusing. Mm-hmm. And then there's these other like Medicare AARP where you have to go to a certain location to purchase your hearing aids. What's upsetting about that is a lot of times patients call and they get this information. Okay, you have this benefit, great. And then they come in really encouraged about it. And we're like, we can't, we don't work with that company or that subsidy. So with a lot of the Medicare plans, although it doesn't pay for hearing aids, some of their supplementary policies have some sort of a discount or some sort of something, but you have to go somewhere really specific. And we've even gone further to try to look these places up in town. And you can look up the networks and you can see like little red pins on a map, but it doesn't say who the provider is, what their education is, what their specialties are, if they see kids. So it's really difficult to say all patients with this insurance go over here. Because not all providers work with kids. Not all providers work with all types of hearing aids. So it's not as cut and dry as one might think, unfortunately.
Yeah, which leads us to the next question that I'll have Whitney take as well. But just kind of know, she'll answer this question for you, but how can you be contracted with my insurance but not participate in the hearing aid benefit? So that we get a lot because we've decided not to participate as our office. So as owners, both Dr. Galloway and I have decided to not participate in the hearing aid benefit for certain reasons, usually because it doesn't benefit us. And so, one thing with looking at different hearing aids, when you are told that you have to go to a particular provider to get this benefit, you may be pigeonholed to get certain devices. But I don't know if there's anything else that, Whitney, you want to add to that.
Yeah, I know this is a question that we get, especially, we have someone that will come in and maybe they are already a current hearing aid user. And so they're familiar with hearing aids and they're like, well, I get my hearing tested, by you every year, and, or you're in my network and I have this benefit, and it's hard, but, we believe in trying to provide you guys not only the best technology, but also the best care. And sometimes plans like that are limiting to what we're able to not only fit our patients with, but also how much, follow-up care and services like that are really important. And I think which set our practice, apart. And so that's why it's not that, we want you to still come and have your hearing tested. And we have plans to help, make, hearing devices more affordable, because we all know it is an investment. But yeah, it's just, we've elected not to participate in that because we want to be able to serve you the best that we can.
Yeah, and serving you the best also is making sure that you have the option of getting the best technology. So sometimes when you are dictated by an insurance to go to these providers who have to provide certain hearing aids at a certain amount, you might be getting devices that the technology is maybe 2 models older, or maybe you have to have entry-level hearing aids versus getting some other technology that might actually help you more. So that you also have to be careful about too, when you are starting to get dictated by insurance companies where you have to go to get your benefit. You might actually be getting hearing aids that maybe a little bit, either like what Whitney said, either lesser value or maybe lesser technology, or maybe they're older in the models, which sometimes could be maybe 2 to 3 years older in the model itself. Yeah.
Well, and at the end of the day, too, I think it's important to point out that insurance companies go to that model because it saves them money. They're not going to that model because it provides you better care. They're not going to that model because it provides more transparency. It just makes things very confusing for the patient. But at the end of the day, they've signed a contract with these, different companies so that they can sell more and get more of that money back for themselves. So I think too, with the way healthcare is kind of moving and things, people are having to kind of make choices on who their providers are. And that's kind of something to look at too, unfortunately. Like Whitney said, we want to be able to give people time. And unfortunately, a lot of those little boxes that they shove you in don't allow you to give somebody time because they pay so little, or there's actually rules against it, like rules against, you paying out of your pocket for care because of the contract. So it's been very confusing. we recommend people come in or have a phone call with us, and we can, try to talk about your specific plan. Okay, this is what does have benefits. This is what doesn't. This is what we can find out. And I think our benefit estimations have been really helpful to kind of let people know this is our best guess of what they're going to pay for this. And then, we can kind of move forward accordingly. But we've seen a lot of that happen, and even contracts that we used to be part of and used to be able to provide hearing aids under, moving to more of these central parties that are in turn benefiting the insurance company. Right. So, and as a consumer too, they send you all those letters in the mail, read them, because sometimes it says, hey, we changed this, and, maybe your voice will be heard, maybe not, but it's also just good to be informed on what the changes are from the patient side too.
Yeah. Yep. All right. And then one of the last questions that we get a lot because of everything that we've talked about is, can I use my benefit at another office then, and then bring my hearing aids back to you to take over the care? And we say absolutely. We don't do it too often because most places do kind of bundle in their care. So if you were to purchase the device there, then it comes with a lot of their services. But it depends. Like if you're going with a third party administrator, or you're going with someplace where you're just like, but I like you guys and I'll go get my benefit there, but can I bring my hearing aids back? We do have transfer of care options as well. So if you decide to purchase your device somewhere else, or get it through your insurance, or through the VA, even we've had that done as well, and come back here, we will still take you on. We're not going to shoo you out the door just because you didn't purchase the hearing aids, but understand that we do have transfer of care services to cover our cost of the time that we are going to be either fitting you or going over, use and care or maintenance, as well as follow-up visits. So depending on what your needs are, we have transfer of care options that we can provide if you were to decide to come back after you did use your benefit somewhere else, maybe, and get those hearing aids there.
I will add to that, there are certain situations where we can't work with the hearing aids, like if it's branded a certain way or locked. There have been hearing aids people have brought in, and I'm, just totally unable to work with them. So that can be the case, where if they're really, really old, like more than 12 or 15 years old, sometimes there's like a technology issue of being able to connect to them. But for the most part, we're able to do that. And then we just charge for our time and our supplies. And that way, even if you have to use that benefit or go under that certain plan, you can still, choose to come back to the provider that you want.
Yeah. So I think those were some of the questions that we could think up for the show today. I know it's not like really a fun or wacky or silly show like we normally do, but this was just something top of mind that came up for us this week that we thought we would talk about and at least try to educate you guys about. As always, we want to be able to spread awareness, educate people as much as possible. And insurance just happened to be on our radar this week. So we thought we'd kind of stop and really talk about some of the issues that we are dealing with, and on a daily basis, really, and having people learn about different things that they might not necessarily know until they walk into somebody's office. We're saying hello to Tom Parkin. Thank you for tuning in as well. He did a episode of us on Colorado Health Matters that you can kind of see on our website if you want to. So thank you, Tom, for tuning in as well. But yeah, so again, nothing super sexy about insurance talk, and we are not insurance experts, but we definitely deal with some of these questions that come up. If you have any further questions, we'll try to answer it as best we can from our provider type of outlook. Again, we're not insurance experts. We have somebody that is an insurance expert that goes through our contracts and helps us out. And so we will try to find answers for you if we can. Anything else, ladies?
I think so.
All right. Okay. Well, share this out if you think people have questions about their insurances and seeing an audiologist, and spread it out there. And we will be back next week with a whole new show. So we'll see you then.
Bye. Thank you.